Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Spears with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast where we share the most up-to-date education for healthcare professionals. Our topic of discussion for this podcast is the role of the nurse navigator, and joining me for this discussion is Alpha LaFleur. Alpha, thank you so much for joining us, and I just adore your last name.
Well, thank you so much, Candace. I appreciate it.
Can you share just a little bit about yourself and your expertise in this area?
So I'm actually an oncology nurse practitioner, and I've been working in oncology for about 6 years. And even though the role isn't specific for a nurse navigator, I do a lot of that role within my time as a nurse practitioner. So, on a daily basis, we are trying to find out what the patient needs beyond their disease or their diagnosis. So, And
I think this is where it started, right? Didn't it start in oncology? So
right.
We're kind of right there,
Exactly.
where it is. So while I don't understand a lot about the nurse navigator role, I understand more of that textbook description. So the role emerged in like those recent decades to help guide and support patients, which I know is what you do. And is particularly with those with complex and chronic conditions, like oncology, trying to help them navigate through the healthcare system. And I know the main goals are to improve care coordination, providing education, and facilitating communication, and really just helping to remove barriers. But really what I'm hoping to learn through our discussion today is those ins and outs of the role and what those day-to-day activities look like, because I think that as healthcare systems continue to just become increasingly complex and patients are facing so many daunting challenges and navigating through the healthcare system, that this role specifically is going to become so significant.
You're right.
And, I've seen some studies. So before we were meeting today, I wanted to look at the studies. And I did see a few out there. And they did show that this navigator involvement really leads to better adherence to treatment plans, fewer missed appointments and delays in care, and really just higher patient satisfaction.
Absolutely.
So to kick us off, can you really just help us understand what exactly is this navigator role and what are those primary roles and responsibilities?
So we act as a single point of contact for the patient. So as they're going through their diagnosis and treatment and everything, they're meeting with so many providers, and that can be a lot. So we kind of are that single person that they can come to and say, the oncologist said this, or the social worker said this, or, so and so, offered me this. What does that mean for me? How can I incorporate that? So, it's nice to have that one person you can touch base with
Yes.
that will explain everything to you and coordinate all of that, because that's a lot on the patient. They're not only, dealing with their diagnosis, they're still parents or, caring for their older parents. They still work and have their other things that they're going through. So, if we can take some of that load off of the patient to coordinate, to be there, to be a sounding board, that is so helpful for them. And like you said, keeps them going through the process as smooth as possible.
Right. Especially when you first get some type of, chronic or scary diagnosis, a complex diagnosis, you can almost get to where, fight or flight. Well, for me, I freeze.
Mhm.
And so, I think that really doesn't help with missing appointments or even moving yourself through the process to try to get better, because you freeze, it becomes
Right.
overwhelming. So how does this help to improve that patient care coordination as far as patient outcomes?
So that communication that we have with the patient and their caregivers and their families is really what
Mhm.
moves this thing forward. So, like you said, if you are frozen and also trying to feel like you have to do this by yourself, it's not going
Yeah.
to be that smooth process. Not that any disease is a smooth process, but we're
No.
trying to make this as smooth as
Right.
possible. So, communicating myself with the patient and their family, and then myself with their providers and other outside specialists that they may have to kind of bring this all together to help the patient is what makes their outcomes so much better than if they were to go it alone.
Absolutely. And my currently I have a daughter who has a very rare condition. She has CRPS. And I actually had to go through that process alone. I had to figure out what our next steps were alone. And I wanted to freeze, but thankfully I have that healthcare background to kind of help me
Right.
navigate through. But most people don't have
No.
that knowledge. They can't
Right.
navigate through. It is so hard. Even having my background and knowledge, it was still so hard to navigate that. I had no idea what to do.
And
So, oh, go ahead.
oh, I'm sorry. And
No,
even
no.
with the knowledge and background, it's one thing to care for someone else, and it's another thing for it to be happening to you or to someone you love. So you don't want to take on that responsibility of provider for yourself and the
Yeah.
patient. So, if that is happening to you or a family member, you want to be able to step back and say, okay, explain this to me like I'm 5, not like
Yes.
I have that background because I need to be taken care of right now and not try to
Mhm.
take care of myself, if that makes sense.
Right. Absolutely. Because, when my daughter was diagnosed with it, it was like, here's your diagnosis. See you later.
Right.
We don't, we don't
Yeah,
work with this. And so it's like, well, but who do I see? Like where
exactly.
do I go now?
And
Who
that's
follows
exactly where the
this?
navigator steps in. They are there to help you with the medical jargon and that piece of it, but also as a sounding board, an ear,
Yeah.
emotional support. So it all brings it together. And as nurses, that's what we do.
Yes, for sure. So when you look at this role, what skills and qualities really make an excellent nurse navigator? And
So
and
that's
how does the role differ from, our other nursing roles that we do?
so um For nurse navigators, I would say that you need that solid foundation that all nurses, get, at least 2 to 3 years as a nurse before you venture out into a nurse navigator. Because remember, you are the expert in whatever disease process you are navigating for. So, this is not the place for a new grad per se. But once you have that foundation, you do use all of your nursing skills, your listening skills, communicating, being able to meet as a group and work as a group with other providers, but then also be able to take this solo and be able to move forward with the patient and be confident in your knowledge and your background and your skills to be able to help that
Mhm.
patient. So, I just think it's that specific nurses' qualities that feel like they can run with this information and be able to help the patient move forward in the process.
Right. So what about like assessment skills and how where do they use those? How do they use those within their
So though they're not typically doing like the physical assessments, daily for like the patient, when you think of like vital signs and that type of thing,
Mhm.
they are using their assessment skills of when they listen to the patient and find out what's going on. Okay, the patient is telling me maybe they're having difficulty with transportation, because if this patient, say, has some other comorbidities, other appointments that they need to go to for a cardiologist, or maybe they're a diabetic and things are now becoming, you know, clashing with each other, trying to get all of these
Mhm.
appointments in together. That's when we kind of pick up on that and say, okay, let's try to organize this a little bit better for you. So it's not really a physical assessment per se, but it's trying to gather all that information, said and unsaid, from the patient, pulling that out of them to be able to
Mhm.
help them, even when they don't know what kind of help do I need. We're trying to pull that out from them.
Right. It's almost like you're still using your nursing skills. You're still making a plan of care. You're still
Exactly.
moving through those steps. It's just a little different
Right.
than seeing them in the clinic.
Right.
So, what is a typical patient experience and interaction? What would that be like? Can you walk us through that?
So some patients are referred for a nurse navigator. Some can be the provider can consult the navigator to bring that patient in. And sometimes the patient can just call themselves and request. So they can be coming at the nurse navigator in multiple different ways, but no matter what way they come to us, they are assessed based on what is already known about the patient and going on. And then
Mhm.
we reach out to that patient. We explain our role, like what we're here to add to what is already their care team, and what we can do to help. So
Right.
that's the typical experience that I would say that they get from the nurse navigator, at least to start. Once we can assess what's going on with the patient, then it can take different avenues. How much do they need us, and in what way, and make that happen for the patient.
Okay. So I know that oncology is really where the nurse navigator role kind of originated, but can you think of some or know of some other medical conditions where these are already being utilized, or it might just be good to start utilizing them
Yes,
there?
absolutely. I feel like for any chronic disease, nurse navigators can be so helpful. I already see them in place for, like I was saying, diabetes, COPD, CHF, those kind of chronic
Okay.
conditions. But also, I've seen them in orthopedics. I've seen them in like gastric bypass patients could also use
Yeah.
nurse navigators. Also, high risk pregnancies. I've seen nurse navigators get used in. So ultimately, I would love to see nurse navigators used in every
Yes.
type of condition, in some way, shape, or form. It doesn't have, it might look different for different
Yes.
diseases, but every patient could use that moment to say, okay, this is my person, they're looking out
Yeah.
for me. So I think it could be useful everywhere.
So, how does this particular role, or do you work in conjunction with? So, my question is going back to like social workers,
Right.
because that's really where I found the most help in trying to navigate the healthcare system was through a social worker through our insurance company. So, how do they? Does the nurse navigator work with the social worker? Is it like how do those connect?
So they can definitely be part of the team. Um, and nurse navigators are former nurses. So we know the disease condition and can speak to that. Whereas the social worker typically does not know
Right.
the medical side of it in that sense. So, but social workers are great when it comes to those social aspects. Like I was mentioning
Mm.
before, transportation or maybe some kind of financial help that was not known of before. Respite care, maybe sometimes that they know
Yeah.
of that could be helpful. So, bringing all these pieces in to try to help is what the nurse navigator does. Bring in the social worker. What piece can you add to this? You know, um, or physical therapy or any like just bringing them all together because we tend to work in silos and
Right.
we know our piece and that's kind
You're
of
not wrong.
where we leave off. So,
Yes.
and that sometimes is not, the best way for the patient to navigate through this system because they need a little bit from everyone and for everyone to be on the same page. So the patient
Hmm.
doesn't feel like they're repeating themselves or, this person didn't know what person A didn't know what person B was doing. And now, I'm wasting my
Yeah.
time or something like that. You never want the
Right.
patient to feel that way. So that's where we can step in and kind of bring it all together from everybody's perspective and then bring that to the patient so that they feel like everyone's on board, everyone's on the same page, and I'm getting the best care possible.
Right. Now, case management versus nurse navigator. How do those
Oh,
work together?
I see more case management for inpatient populations, and I work outpatient, so
Right.
not really working too much with case managers as and I could be wrong, but I feel like their position kind of is moving that patient through like physically moving that patient through the process. Do they need to, now they're in maybe they're in a med surg unit, and then they need to go to uh
Like a long-term
rehab or
facility.
something like
Yeah.
that. They
Or
need to,
home.
or home. How does that
Hmm.
best work for them? Do they need a wheelchair at home? Do they need a whole new setup at home based on
Right.
what's happened in the hospital? So I feel like that's more their track that they do. But again, if we're all involved, I feel like that is what makes this the best transition for the patient. So if I'm also hearing what's going on from that case
Right.
manager and can be able to relay that, to the patient, like this is what's going to happen, I think that that's what best works out for them.
So really, I'm seeing case management is more of how to get them to how to get them
Step.
out of the hospital to their next
Right,
step, either home or long-term facility.
right,
Whereas that nurse navigator is, working on the care plan for that
right,
patient from maybe like a bird's eye perspective.
right,
So kind of looking down over the whole thing. So they're still with them, probably, even when they leave the hospital, and they're continuing through their care.
right.
Would you say
And I
kind
would
of
say that's exactly right, because we have that relationship with the patient that we can call them in the hospital even to say, hey, what's going on? What do you feel like is not working for you there? Can you've been
right?
talking to who as your social worker? Maybe I can reach out to them and kind of,
Yeah.
you know, explain something to you if you feel like you're lost a little bit. So it's just like having that, person, like I said, that one point of care that I know I can always call that person, and they
Hmm.
can, help me with this question or with this situation.
Right. So, how does that nurse navigator effectively collaborate and communicate with the healthcare team as a whole, the whole healthcare team?
So that's always the situation.
That's always a
Um,
challenge,
you
right?
know, it is a challenge. There are so many ways to communicate. I've used, just the phone call. I've showed up in person. Um, we
Let
also
me
use
talk to you. I
right
need to talk to
meeting.
you.
But exactly. So, but not everyone's available 24 hours a day. So, we
Right.
do the best we can. Um, but that is always my goal, to try to bring that communication together, however way works for that other person that
Mhm.
I'm trying to, bring in. So, email, Zoom, telephone, telehealth, whatever we can do to kind of get that
Right.
together.
So, other than kind of getting in contact with everybody when you need to on the healthcare team, what are some of the like the other biggest challenges and barriers that you face in this role?
Um, I would say also that even though this role is not new and it's, continuing to kind
Hmm.
of spread out, there's still not 100% buy-in, I would say, from
I
every
can
health
see that.
system. Right. So,
Do you think it's not buy-in, or do you think it's like not understanding the role or
not
not taking
understanding
the
the role.
time to
Like you were
understand it?
mentioning, there's already the social worker, there's the case manager. Well, why do we need this person? Or, you know,
Right.
how does that work for us? So that's one way where it can kind of get a little tricky.
Hmm.
Also, cost factors are also part of, you know healthcare, obviously.
Yeah.
So, you know billing is one thing that kind of is an entanglement for navigators, as our work doesn't necessarily get billed,
Hmm.
in the like how a nurse would and everyone else
Right.
gets, billed for. So if we can't show our um worth, as per se, like, in dollars
Hmm.
and cents,
Yes.
sometimes that can be a little bit tricky.
Hmm.
Um, but, you know, the work we do is not necessarily can be shown, okay,
Right.
in dollars and cents. But
It's
those patients,
non-revenue.
right,
Like education is non-revenue, but it's
right,
needed. It's
but it's needed.
necessary.
So you have to get
Hmm.
those stakeholders to really see that, how the patient outcomes are on the other end, and, and buy into our role, that us doing what we do is what got the patient to this outcome. And, how
Right.
they, appreciate that is how we can move forward as well. And being able to see it in
Absolutely.
other diseases and diagnoses.
Absolutely. And that's tough because I was at one time I was over a professional development department, and we're non-revenue,
Right.
and in the hospital you have that's how they show their worth for
Right.
every unit is as the revenue that they bring in. So we had to find other ways to try to show how we were worth having. And that's hard. That's
It's
really hard to
hard.
get buy-in on that for sure. So how have you, I know this role has been out there for a couple of decades, but it's really just now kind of starting to catch up. And I part of me wonders if it's because we're watching the healthcare system get so complex,
Mhm.
just layer after layer of it. So how has this role kind of evolved, and where do you see it heading in the future?
Hmm. Uh, how has it evolved? I think we've just been able to take on more of a leadership role. So, that's how I would say it's moving forward, in that, we're really more visible, and
Mm-hmm.
being able to kind of really coordinate that as leaders of this team. And as I see it in the future, I think we would just I would hope that it would explode even more, like I said.
Yeah.
Being able to just really have that seat at the table when these decisions are being made about healthcare in general,
Mm-hmm.
so that we can, before the progress gets so complicated, maybe we can be working, ahead of all the complication, and try to mitigate some of that before it even happens. So, as nurses, we know, okay, if we are dealing with a breast cancer patient, typically this is the process. Maybe, somewhere in the beginning, we can be working towards changing that downstream process. So none of that, you know, some of those challenges can be taken care of before it even becomes a thing,
Right.
if that makes sense.
Yeah. Yeah, for sure. The challenges that you see in multiple patients trying
Right.
to catch those and new patients before
Right.
you even get to where that challenge came
Exactly.
up. Absolutely. So for nurses who might be interested in
Becoming a
becoming a
navigator.
navigator, what education, training, certifications or anything like that would you recommend for somebody who was really interested in this type of role?
So, like I said, I think at least 2 years of being a nurse is what's a great foundation, for being a nurse navigator. And then there is no upfront education or certification that I was aware of for a nurse navigator, but if there is one already working in your facility, definitely shadowing them, interviewing them, asking them how they work in this role, or others if you know anyone else that does that position, because it's a lot of thinking outside of the box.
Yeah,
As
a lot of
nurses,
gray
right,
areas.
right. As nurses, we're, used to, okay, here's the order and I'm fulfilling the order. But,
You.
this is more of a thinking outside of the box, you know, kind of making the care plan up as you're going, you know?
Hmm.
So, if you have that type of, personality to be able to, do that, then maybe this is something for you. And then if you actually get into this role, there are certifications that you can get after working in this role to show, your competence, and working in this role. And oncology, obviously, as the first ones, does have that certification, but I've seen them also for cardiovascular, for diabetes. So if
Yeah.
you're working in those specialties, you can be certified, as a nurse navigator, but again, that's
Yeah.
after working in the role for some time. So it would kind of be like, since there isn't a formal program for nurse navigator, it would be on that person to kind of seek out CEUs, or, like I said, other people that are in the role, to kind of
Right.
educate you along the way of, how would I do this?
So, as you've kind of been talking about the role, I've been thinking about like education and certifications. And so, some of the things that seem like they might really be helpful would be maybe some continuing education along the lines of education for
Right.
sure, like how to teach patients, understanding how to teach adults or even pediatrics if you're working in a pediatric setting. What about like case management? You know, they have certifications in case management. Would that be something that would be a good tool to have in your tool belt?
Certainly some of the role overlaps with
Mm-hmm.
case management. There are definitely some things that we can pull out from maybe their education process that definitely would be helpful.
Yeah.
Um, for a nurse in this role, having difficult conversations, those types of
Mm-hmm.
education that aren't necessarily listed under nurse navigator, but
Yeah.
definitely would be part of, your role. So, you know, having something that would be put together like that would be amazing,
Mm-hmm.
to just have that, one place to go. And, it's always, I also teach nursing students, and in thinking of what else can we bring
Yeah.
to our nursing students um, as an aside to what they're already learning in school, and
Mm-hmm.
so teaching them things like difficult conversations, and just reaching out to other people, communication. That's always
Mm-hmm.
you know the best foundation for what you could be
Right.
learning, in school.
And then I was thinking too, like understanding your what your community has to offer.
Absolutely.
Like being familiar with all of the opportunities that they have for patients. I was thinking along the lines of like grants for things that they might need, or
Absolutely.
resources, like you were talking about transportation earlier. So it
Right.
seems like also really just having a good relationship with your community and knowing what they offer seems like it would be something really good to have in your tool belt as well.
Absolutely. In the patient's own social circle, they could be involved in churches, they could be involved in, other support groups, and those are
Yeah.
definitely helpful. Um, Branching out to what the state has to offer these patients.
Mm-hmm.
And going back to something else that is also important to know is how insurance works for these patients, what kind of
Yeah.
grants are available. So, because financial burden is such a burden to these patients,
Yeah.
and whatever we can do to help alleviate some of that is definitely part of our role as well.
Mm-hmm. And you know, being that sounding board too. And
Exactly.
when you have all of that information, being able to be a sounding board to be like, well, here's some options, and let's figure out
Exactly.
which one's the best for you. That's so good. I love this role. The more I hear about this role, and just I feel like that's something that's missing is the bird's eye view of a patient care plan. You know, everybody
Exactly.
has their own piece that you said that they're owning, but having someone that has the bird's eye view and then can see where we started and where we're headed and how we get there. It just so good. I just love that. And I wish we could, I wish we had it in every hospital. I wish we had
I'm
it all throughout our
I'm hoping that's
system.
coming.
Me too. Um, but because it just seems like the more that you have a bird's eye view, I can see it helping with improving care transitions and reducing hospital readmissions,
Exactly.
by having that there. What advice would you give to someone who's, considering doing this in their organization?
So, if someone's thinking of if getting into this role, I would say if you're thinking of this, you already have that drive. You're wanting to help patients in a little bit of a different way than you would as, the nurse at the bedside. So
Right.
go with that, use that foundation you already have, and, you're just going to be thinking more like outside of the box. What else can we do for these patients that we're not already doing? What can I bring to the table to help this patient? And it just blossoms from there. It really does.
Right. So, yes. So, we've come to the end of our time for this episode. Alpha and I will be continuing this discussion in episode 2, looking at more of the practicalities, unique challenges, and those professional factors related to being a successful nurse. Alpha, thank you for helping us understand the role of nurse navigator.
Thank you.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.